All right, well, welcome everybody. Thanks for making the journey in for our commission meeting. We'll start off by doing introduction of commissioners, and that'll be our way of calling roll. So let's just go around the room, introduce yourself, let us know where you're from. And also, real quick, briefly, thank you, Director Cartmel, for being here. We're excited to have you a part of the group. And thanks for carving out this time in your day. So welcome.
I'm Melinda Front, Director of Department of Rehab Services. Deb Shropshire, Director of Human Services.
Jeffrey Cartmel, Director of Office of Juvenile Affairs.
Jonathan Hall, the governor's appointee representing business and industry.
Jacqueline Aaron, Director for CASA of Western Oklahoma, representing.
Haley Kurth, I'm a pharmacist at Southwestern. I'm on this board representing HARD as a foster parent.
I'm Brad Wilson. I have been appointed by the governor representing the Oklahoma Bar Association.
Good morning. My name is Lindsay Laird and I work for OCCY, appointed by the Senate Pro Tem as an individual with interest in improving child serving systems and does not work for an agency that receives state funding.
I'm Kathleen Arrieta. I'm the OCCY Executive Assistant.
And I'm Mackenzie Hill. I'm the Assistant Attorney General here today in replace of Sandra. She could have been today.
Perfect. And I'm John Schneider. I'm the Director at Youth and Family Services here representing the Oklahoma Association of Youth Services.
And we have a quorum.
Perfect. Thank you so much. And thank you so much for being here and joining us today. We appreciate that. Okay, do we have anybody signed up for public comment?
We do not.
We do not. Okay, we'll move on to agenda item number 3, review of minutes from the September 15th, 2023 commission meeting. Is there anybody like to make a motion?
So moved. To what? To accept, I'm sorry. Second. So moved to accept the September 15th minutes.
All right, one moment. Commissioner Aaron,
Yes.
Director Cartmel,
Yes.
Director Front,
Yes.
Commissioner Hall,
Yes.
Commissioner Kurth,
Yes.
Commissioner Laird,
Yes.
Commissioner Schneider,
Yes.
Secretary Shropshire,
Yes.
Commissioner Slayton Hodges. Oh, I'm sorry. Commissioner Wilson,
Yes.
and the motion passed.
Awesome, thank you. Okay, agenda item number 4, discussion and possible vote to approve the Finance Committee report. And I will turn it over to our business manager, Mabuse.
Jared, is that he needs his PowerPoint, I think.
That was the one that was
The clicker, you mean?
downloaded.
Yeah. That's just his. Yeah. That's it. No, that's not the right one. It's there, I saw it.
Why don't we move down the agenda 1 while we figure this out and find the presentation and come right back? Would that be okay? Okay, we will move on to agenda item number 5, a presentation from OCCY Parent Partnership Board. And I will welcome up Nubia Giselle.
Gracias. Buenos días. Good morning. I'm a little bit nervous, so English is my second language. Bear with me. I'm going to read it. Otherwise, my English escaped when I'm a little bit nervous. I'm in charge of sharing the Parent Partnership Board activity report, which is attached to your packet. But I will rather take this time to have the opportunity to share my story with all of you at OCCY Commissioner meeting. My name is Nubia Faisal, and I'm a member of the Oklahoma Commission on the Children's and Youth Parent Partnership Board. I was born and raised in Uruguay and immigrated to this beautiful country 30 years ago. I'm the mother of Annie and Anthony, who are my greatest pride. At the age of 17, I met my husband in Uruguay, a retired military officer and the father of my 2 children. I emigrated with him to the US in 1993, unknown to me at the time, probably due to my upbringing and young age. He was an abusive man and an alcoholic. After 5 hard years of marriage, I finally find the strength to leave him. What I did not know was how difficult my recovery will be. I was alone in this country, first generation immigrant with 2 small children, no family, unemployed, uneducated, unable to speak English. I was a victim of abuse. It took me a while to comprehend my reality. But when I finally did, I asked for help. I went to my local clinic and shared my truth. They gave me a referral list for mental health services full of names and phone numbers. And then really hit me. Finding a bilingual mental health provider will be nothing short of a miracle. Unknown to me, there were only a few licensed bilingual therapists working in Oklahoma City. I finally find an English-speaking therapist willing to help me. My therapist and I struggled to communicate. Nonetheless, she made me feel important, valuable, and cared for. She helped me and my children's heal, establish healthy relationships, decrease my depression, and be able to provide a healthy and stable environment for my children. But not everyone who has experienced trauma or difficult situations has a chance to heal. Mental health services should not be a luxury or an unattainable dream. Too many of our families and children are suffering from loneliness, anxiety, depression, trauma, addiction, and other ailments. All 77 Oklahoma counties continue facing a shortage of mental health providers. The increased need for mental health services, exacerbated by the pandemic, led to long waits for services and unimaginable workload for providers. Oklahoma providers' reimbursement rates are below the national average and some of the lowest among surrounding states. Low pay, burnout, years of expensive training, including 3,000 hours of supervised counseling, cause mental health providers to leave for better paying jobs. And this BISSUADED. There you go. Others from entering the field. According to a 2022 study by the American Psychiatric Association, there was an 18% decrease of Spanish language mental health services provided in the last 5 years, while at the same time, Oklahoma is one of the states with the fastest population growth of Hispanic families, 42% since 2010. Residents in rural communities have few nearly treatment options with limited public transportation and high poverty rates, making it difficult to access care. I ask on behalf of those who do not have a voice to just never stop fighting to find solutions to the shortage of mental health providers who work with low-income families, with immigrants, with minorities, and in rural areas. Identifying and reducing the barriers to obtain quality and culturally appropriate mental health services is essential if we want to live in a healthy and in a happy Oklahoma. In 1999, I got my first stable job in a pediatric clinic. In 2020, I became a US citizen and I earned my GED. 2014, graduated from OU and started my mental health, and I got my mental health and behavioral health license as a therapist. Now I live with my husband, enjoy my kids. My son has an English major and is going to Europe for a master, and my daughter is doing a PhD in Boulder, Colorado. Before I finish with this little speech, it's very hard. Providers, it's a very hard job. We work evenings because kids are at school, families are working. We work weekends. The amount of paperwork is like having another child following you. Every few months, I ask myself, it should be so much easier to have a different type of job, finish hopefully at 5, relax. Then I remember why I do it and why it's so necessary. Thank you so much. Love you.
Incredible story. Thank you so much for sharing. Much appreciated.
And can I hop up a little bit? So I don't know if you all have had a chance to meet with the Parent Partnership Board. If you haven't, please do, because it's fantastic. I mean, I got a chance to meet in the last, since the last one of these meetings. So sometime in the last month, I don't remember when it was, and it was a really fantastic experience. So just encourage you that direction.
Awesome. I saw the picture on Facebook.
It was fantastic. And I took home a to-do list and we started working on stuff. So just know that too. Bring your notebook. Yeah, there's an answer, especially if you have an agency.
Okay, are we ready to circle back? Okay. Well, thank you again. We really appreciate you sharing. We will move back to agenda item number 4, discussion of possible vote to approve the finance report.
Yeah, button.
Good morning. I'm very sorry for that. I am Mehboob, business manager at OCCY. First of all, I want to begin by expressing my gratitude to you all for being so super and supportive, friendly audience. Thank you for that. Today, I have a brief presentation, basically covering the expense report for the first quarter. Total budget allocation for the year was 4.7 million, and year-to-date budget, that is for the first quarter allocation, it was 1.1 million, and utilization for the first quarter as of 30th September 2023 is $693,000. It makes, I have compared both the things to the total budget and year-to-date allocation. Ideally, it should be a 25% for the first quarter, this utilization, but definitely we all understand the program activities are not spread equally all over the financial year. So activities is basically planned in different time periods. So it's not ideally the 25%, but overall our major activities or expenses are on track, and we are 15% utilization as compared to the total budget. If we see the year-to-date allocation for the first quarter's budget, and we are over the 58%. This is the major account head expense-wise details. And here again, I try to make both comparison to the total budget and year-to-date budget allocation, that is the quarterly budget allocation and the total budget. We are like the 15% of the total utilization for the total budget, and we are at 58% of the year-to-date budget allocation. This is a detailed expense-wise account head details with different account codes, and it shows the same utilization or same trends with respect to our different account expense. We have this is cash balance report, and our total available cash balance is $700,266 at this point of time. That is on September 30th, 2023. Mainly these three account heads are basically the different temporary accounts that are used for the payroll, withholding, or clearing accounts. But our main account with the different fund type main account balances are these for the revenue funds, for the revolving and Kenta funds. So we are good at balances at this point of time. Overall, with the commissioner packet, we have detailed reports annexed that are system generated through the financial PeopleSoft systems included. As a part of our regular practice, we analyze the agency's financial with our OMS colleagues on every month, and our aim is basically to identify any areas of concern and to take appropriate measures to resolve them. Additionally, we believe we have that we are progressing well towards our agency's financial, while diligently meeting all the documentation and procedural requirements. So this is the end of my report, and if there's any discussion or any question, I will try to answer.
Thank you. Any questions? Okay. Yes, so I will entertain a motion to approve the financial report.
So moved.
Okay. First and a second, any further discussion? Please call roll.
Commissioner Aaron,
Yes.
Director Cartmel,
Yes.
Director Front,
Yes.
Commissioner Hall,
Yes.
Commissioner Kurth, Commissioner Laird,
Yes.
Commissioner Schneider,
Yes.
Secretary Shropshire,
Yes.
Commissioner Wilson,
Yes.
and motion is passed.
Perfect, thank you. And thank you so much for your report, appreciate it. Okay, we'll move on back down to agenda item number 6, legislative report and discussion, and I will turn the floor over to Marcia Johnson. Thank you.
Well, good morning. Very quickly, I just wanted to tell you about an interim study that I attended last week, and then provide an update on some of the legislation that we're working on for next session. There were 4 interim studies last week, and our own esteemed chairman was at one of those on juvenile justice. The one I want to tell you about has to do with child labor laws. This interim study was requested by Representative Judd Strom due to concerns brought to him by our state labor commissioner, Leslie Osborne, and others. There's a movement afoot in some states to relax their child labor laws. We saw this in such states as Arkansas, Iowa, and New Jersey. And the reasoning for doing this varies. One argument is the tight labor market. Another argument that was presented had to do with relaxing the child labor laws gives young people a greater opportunity to learn skills that are needed in the workforce. One of the presenters, though, pointed out that high school students who work more than 20 hours a week are more likely to drop out. And if they don't drop out, their grades suffer tremendously because they're sleep deprived. And I just wanted to bring this to your attention because there is speculation that similar legislation might be introduced in our legislature this session. The interim study that we requested looking at access to edible medical marijuana, young children ingesting it, is going to be held on Monday at 9 o'clock. It's in room 5S2 of the Capitol building. If you want to be there in person, if not, it will be streamed on the House website. So if that's something that interests you, you can follow along there. Next, I want to bring you up to date on some of the bills we're working on for next session. Due to the early December bill request deadline, we start working on ideas in the summer, and some ideas that we work on don't pan out, but we've kind of narrowed down a couple of things that I want to talk to you about just as a concept. And then as we progress, if we're successful in progressing, then at the January meeting, we will present that to you as an actual bill for you to vote up or down whether it goes on our legislative agenda. You're probably aware that the commission has a homeless children and youth steering committee, and this group of folks has been working on the issue of unaccompanied homeless youth not having access to a copy of their birth certificate or the ability to obtain a state ID. There are a couple of hurdles to this. First of all, individuals under the age of 18 don't have the statutory authority to request the birth certificate or to obtain an ID or get a driver's license. And the second part is that even if they did, they don't have the money to obtain those documents. So the homeless steering committee, homeless children youth steering committee, is looking at changes that would allow children between the ages of 14 and 17 to request a copy of their birth certificate and to obtain a state ID. The rationale for starting at the age of 14 is because that's when kids in Oklahoma can start working with a permit under the child labor laws. So that's the one issue that we're looking at. And then for individuals that are 18 and over, the steering committee hasn't settled on an upper age limit. So whether it's 18 to 22 or 24 or 18 to 21, we haven't gotten that far. But for 18 years and older, they can request a birth certificate and they can get a state ID or a driver's license. So for them, it would be the state would bear the cost for the first issuance. And I forgot to say that previously. So for 14 to 17-year-olds, they'd be authorized to request a copy and to get an ID, and the state would pay for the first issuance. And then if they needed a replacement, they would be responsible for that. So basically what this group is looking at, I'm not a homeless expert at all, but starting at age 14, if you're homeless, you're separated from your parents, you don't have a permanent place to live. One of the ways to start climbing out of where you're at is to get a job. So that is the focus of this group, and that's kind of where we're starting from. The second piece of legislation that we've been working on would exempt the local PARB boards from the Open Meetings Act. And as many of you are aware, the local PARBs are made up of community volunteers. Their primary statutory purpose is to review deprived child cases and make recommendations to the court. Virtually their entire meeting is held in executive session. So right now they put out notices of meetings, post them at the courthouse or wherever they're meeting. And I personally am on an Oklahoma County PARB, and in the time I've been there, we've never had anybody show up. And if they did, they could come in and watch us call roll, and we have a quorum, make a motion to go into executive session. That passes, they have to leave the room and sit outside for 2 hours while we go over the cases. And then we exit the executive session, they can come back in and watch us adjourn. So in this case, it really would free up the volunteers to not be bound by the open meeting requirements. And this was a recommendation of the State Post Adjudication Review Advisory Board that Dr. Kurth is a part of. And that board, which is a state level board, would remain subject to the Open Meeting Act. This is very similar to a bill enacted in 2019 that exempted our freestanding multidisciplinary teams from Open Meeting Act. Lastly, I just want to mention that we do have a carryover bill from last session, Senate Bill 696. That was our agency's administrative cleanup bill. It got hung up over in the House, on the House floor. It passed out of House committee. We were trying to get it scheduled on the floor of the House, and that's when the governor was vetoing Senate bills because of who the Senate authors were. So our House author felt like we should probably just hang on to it, not risk a veto, and pursue it next year. So we'll be trying to get that off the ground next session when they start hearing Senate bills in the House. And then I don't see any reason why it won't pass. It'll go to the governor and wait for his consideration. So that's all I have.
Thank you so much. On the agenda is agenda item number 7, presentation on Oklahoma Child Welfare Task Force. And I'll welcome up Dr. Deb Shropshire.
Controller, or do you want me to tell you?
We have a controller. right
Perfect. I have the power. Thank you. All right. Well, thank you for the opportunity to kind of update this group. Some of you have been, maybe are familiar, some of you may not be. But in January, the governor issued an executive order, actually on my first day as agency director, inviting a task force, ordering a task force to come together to make some recommendations around some specific child welfare topics. And so that task force met. The sort of due date for a final report was October 1st. And so this is the information I'm going to present is kind of the process of that task force as well as the recommendations. You do have a copy of it in your documents for today. It is a little funny. It's scanned a little funny to read, so you can also find it online, and then it's easier to see there. And then if anybody is dying for a copy, we can get you an actual copy. We're going to go through a few things related to this. So there were several goals. Can't see it right here. There were several goals related to this specific task force that were laid out in the executive order. And so one of those had to do with reducing the time to permanency in the foster care system. A second, reducing the number of reentries to the foster care system after discharge to permanency. Identifying risk factors that led to the removal of children from their biological parents' homes. And then identifying and proposing areas of support for biological parents. So you may, for context, you may know that child welfare has been involved in about a 12-year or so, 11-year process of reform as a result of a settlement related to a lawsuit. And permanency timeliness is one of the areas of that lawsuit. So the lawsuit doesn't encompass the entire child welfare system. It has 7 focus areas. Permanency timeliness is one. And what that really is about kids not lingering in the foster care system. So it's about saying, if a kiddo needs to go into foster care, how do we ensure that if they're going to go home, that they are able to make their way home and the right services and supports are in place for families? And if they are going to move into another permanent option, such as adoption or guardianship, that occurs in a timely manner. And so there's been a lot of work done already by the state over the last decade around this issue, but it is still an issue that, at least at the beginning, at the entry point to this executive order, we were still significantly off pace with kind of the national average around permanency timeliness. Okay, there's a lot more factors that go into permanency timeliness than just time. There's services and other kinds of things. So that's why you see some of these other topics hitting the executive order, like what's the service array look like? Why do kids enter foster care in the first place? It wasn't just about permanency timeliness, but that was one of the driving things that sort of brought this to an executive order. And as somebody who's been running the child welfare system and navigating the lawsuit, the idea of bringing a committee together, which was largely stakeholders outside of the Department of Human Services, for them to make recommendations was both exciting and also terrifying, because when you're in the middle of a lawsuit, you're not exactly sure how those recommendations are going to go. But one thing I would say about the issue of permanency is that it is not simply a Department of Human Services issue, and it cannot be solved simply within the Department of Human Services. And so the value, I think, of the way the task force was laid out, which had a number of members from judges, or a couple of fantastic judges who participated in that, as well as lived experience, as well as foster parent, folks that represent foster parent voices, and other systems such as Medicaid. The value of having that group together was that really the recommendations reflect opportunities for work or improvement or effort in multiple systems, not just within the Department of Human Services, although certainly the department carries some amount of burden on improvements as well. I want to just mention for a couple of minutes the process, because it really was a pretty powerful way that we assembled the work of the task force to be able to get to the recommendations you're going to see. And if you read the report, it reads almost like an academic report. There are citations around research, around where not just data was pulled from, but where recommendations were pulled from, and where other states or entities have evidence that certain recommendations work. It really was a pretty nice body of work. And one of the important priorities of the committee very early on was to make sure that not only did the 12 members who were designated by the governor, not individually, but by their role, that the voice that came through in this report was not just those 12 people. It's too big and complex of a system. And so you'll see as we go through a little bit of this, how the group incorporated voices from many other systems and many other stakeholders. And so early on, the initial work of the committee was to review data and literature, existing data and existing literature around permanency and prevention efforts, to engage stakeholders. I'm going to show you that here in just a minute, to really then, with all of that information, to then have ideation around proposed solutions, and to actually prioritize those and rank those based on how impactful they were thought to be up against the 4 priorities of the executive order, as well as what evidence there was. So it wasn't just like, here's an idea. It was linked back to the burden, the level of evidence that there was around meeting that, the likelihood of successfully implementing a solution. So it was a really interesting kind of approach for this task force to take. And I would tell you, when you talk about the idea generation of solutions, what you're going to see is a pretty robust set of recommendations. There's probably 4 times that many that came up in that ideation, and we had to really distill down to things that it felt like could move the needle the most. A lot of research and literature review that went into those ideas that were generated, again, to help with prioritization, culling action items that are already in progress, because sometimes people had recommendations or ideas that actually were already in motion. And so culling those out and saying, those are going to continue forward. What else do we need to do? And then grouping and synthesizing and ranking those recommendations. So a lot of work. We put a ton of staff support kind of at the feet of the committee and just said, you know, here are the folks that can support you, come out with your best recommendations. And really, I think the department sees it as the best roadmap forward. We're winding down the end of this season of reform. What's the state's roadmap for the next 5 or 10 years to continue to get better outcomes for kids in foster care, but also for families? So this is a slide that kind of demonstrates that ability to include, or the effort that the committee took to include other voices. So there was a variety of ways that was done. Some were through virtual engagement sessions, and that included committee members interacting with child welfare staff, all different kinds of workers, permanency workers, foster care, youth transition services, child protective services, investigative workers, school-based social services, as well as with parent partners, as well as with youth, as well as with foster parents and with tribal partners. So a wide variety of folks that were interacted with very directly. And then through a course of actually 17 different engagement sessions and 125 participants in that. Then also what was utilized were some surveys, again, among child welfare staff and foster parents to get a broader reach, but also around other systems. So the executive order identified seats for 2 judges, but district attorneys were not actually in that original membership of 12. So one way to reach district attorneys was through some surveying. We also were trying to figure out, how can you get people to participate when their schedule may be somewhat limited? So having direct sessions was harder to do, but surveys was a little bit easier. Same with even with other attorneys who may represent parents or kids, or district attorneys beyond just the voice of the few folks we could engage with. And then also judges. So there were 2 judges at the table, but there are a lot of judges out there who are working with these cases, as well as advocacy groups. And in the course of those surveys, we saw a pretty tremendous response. So on the district attorney and the judge surveys, more than 50% of all those who work in these cases responded to the survey. So we saw a really good response. A total of 1,357 survey respondents. So beyond the 125 direct folks that were engaged, another 1,300 plus that responded to surveys. And that really gave the task force, not only did they have sort of all this data and research, but they really got to hear the voice from a broad array of folks that are involved in this system. I think it made the recommendations more powerful. I also think it set the ground for people to want to know what's next and potentially for implementation. Because I think one of the challenges for task forces sometimes is do a lot of work, come up with recommendations, and then who's going to, and I'm going to talk about who, you know, sort of where we go next, but who's going to actually do anything with them, or is it just going to turn into a pretty report that we all sort of stick in a file cabinet? And engaging that broad number of people, in a sense, created a natural interest, buy-in, I think even accountability. People are looking for the report. They're wanting to know what it says because they contributed to it. So I think it actually, that method, while the method was taken on by the committee as a mechanism for making sure we got the recommendations right, I actually think the method is going to work to really prime the pump for implementation, if that makes sense. So the recommendations were also kind of sifted through a set of questions, again, with the members. Actually, I just have to say the 12 folks that were appointed for this committee did enormous amounts of work. I mean, all of this work was done directly. So they had a ton of staff support, but they spent, I don't even know how many hours. I would guess the average member of that 12-member committee spent a couple of hundred hours, if not more, over that 7-month or so process, maybe more. I don't know that we tracked that, but it was a lot of hours that we asked from them. And so they were sifted, the recommendations were sifted through these categories. What's the recommendation? What's the specific problem or system issue it's intended to solve? What's known about the problem? That's where your research and listening came in. What's known about the expected impact of the recommendation, and what would be needed to implement the recommendation. One conversation that was a big conversation is, let's not have recommendations that are not implementable. Doesn't do any good. let's find the things that we actually think can move the needle and that we can actually accomplish in our state. So action items, responsible parties, resources, funding, partnerships, all of those kinds of things were identified, at least initially, as we were kind of working through this. So since they were writing a little bit of the implementation at the time, they were writing the recommendations. So I'm going to go through the recommendations just real quickly. And the first one, these were broken into kind of 5 categories. The first category was around service array. These were categories that the group, that was the executive group that was meeting, kind of ultimately identified as 5 buckets that they wanted to address. So service array was the first one. Each bucket had a couple of champions within the task force that said, hey, we'll take on focusing on that, because otherwise there would have been such a breadth of focus that you really would have had a hard time handling it all. So in this particular case, Traylor Raines from Healthcare Authorities, our Medicaid director, and Deborah G. Smith, who was previously a child welfare director, but currently serves as Adult and Family Services Division Director in DHS. That's the division that has all the safety net programs for DHS. So benefits, your SNAP, TANF, childcare subsidy, energy assistance, et cetera. So these are 2 professionals who are operating systems that can directly influence supports to families. Okay, so that's why service array kind of fit with those folks. And their goal was to expand resources and services to prevent families from entering the child welfare system, because reducing risk factors for families can reduce entry into the child welfare system. And let me just tell you, I'm going to hit the high points. There is a ton of rationale and content in this report. So if this is something that is of interest to you or piques your interest at all, please read the whole thing, because it is really quite a nice story of how and why, what the rationale is to getting to all these recommendations. But here are the recommendations that came out. So related again to expanding resources and services to prevent families from entering child welfare system. Specific recommendations were about coordinating efforts across systems. There was a thought that by and large, there are lots and lots of services out there, but people don't know about them or they're not well coordinated. And we heard that, we saw that in data. We also heard that from the folks that were being interviewed about, even on the, when we have a group of people in the interview, you'd have someone talk about some service that was really great. And someone else on the call would be like, wait, what is that? Tell me about that. And so they were even learning about services from each other. And that's great, but it's also a problem, because if whether you're in a school system or whatever kind of space that you're in and helping families, the ability to know what's available to families it's just fragmented. And so coordinating efforts across systems and communities was believed to be something that needed to be a focus area. And I think where this is going to play out probably is in thinking about how we leverage technologies to do that, because technology is such a powerful piece of holding information within communities. There are so many different technology systems right now that people are using for almost like resource and referral guides, right? And so some of those have capacity to do things that are HIPAA protected, like make a referral or deal with the healthcare system, mental health system. Others don't. They're more like a resource guide. But there was the recognition by the committee that it is a great time for the state to figure out how to coalesce a strategy, particularly around technology, and then also around how do the different folks that are running into families utilize something like that in a consistent way to coordinate their efforts. So a lot of work around technology is what is recommended. Also building community capacity through supports and resources. There were specific resources that were identified along the way that need to be expanded. One example of that was Safe Families Oklahoma was identified by multiple folks that were interviewed as an approach. Safe Families is in statute from 2012 or 2013. It was an approach that was developed in Chicago and has been spread kind of nationally, although in small pockets, and has been in place in Oklahoma actually since about 2014. I remember sitting at a community board meeting, and Ed Lake who was our director then, came and said, you know what Oklahoma needs? It needs Safe Families, because he had experience with it in another state. And what Safe Families is a program that assists families who are in crisis before there's a danger situation, before a child's in danger and child welfare becomes involved, and provides really some opportunities for families to sort of problem solve around child safety. And so anyway, Safe Families is something that has been here in Central Oklahoma. We heard about it, and the committee recommended that be expanded. school-based social services. So the Department of Human Services has a school-based social services effort, but it is still relatively small, 55 or so schools. Some schools have school workers of some kind, social workers of some kind, but many schools do not. And so the recognition that having a social worker in the school setting, and specifically one who could be tied to large benefit systems like the Department of Human Services, was something that was identified as well. And then transportation was a hot topic constantly, the barrier that transportation can be if you aren't able to access it when you're needing to get to a service. So attacking kind of in a very organized way how to strengthen the transportation system. And I know the Department of Transportation has been doing surveys and all kinds of things around trying to figure that out as well. So I don't think a lot of this stuff is not necessarily new. We just consolidated it into a report that was a little bit more intentional. Creating a system to connect services to children in use with complex care needs. And this was a lot about how services are coordinated when you have a specific client with complex needs. And it was also about the idea of figuring out how to leverage referrals to the hotline that are screened out to get families to services earlier. A few states have figured out how to do this, where you have a child abuse call comes in the child abuse hotline, but not all of those calls have to be acted on, or even within statute are allowed to be acted on by child welfare. But those are a call for help. Like somebody's saying, a kid's coming to school hungry, or this family doesn't have what they need. How can we capitalize on the information we have about a family to figure out how to get that family connected with services? It sounds easy. It's actually tricky for some reasons we can go into if we want to at some point. But we are going to take, there was a recommendation to take a step at saying, listen, sometimes we knew ahead of time that there was a problem. What are we going to do to connect people with resources to hopefully prevent that? So that was one of the recommendations. And then another recommendation, and this kind of mirrored a recommendation that came out of that help, I think it was called the Help Task Force, that was around expanding and funding Medicaid benefits to 205% of the poverty level for biological parents with children in care at risk of being in care. And the idea here is that if you have families who are really struggling, then often mental health or substance use is a player in that. It's a dominant reason that kids enter the child welfare system. So if we could figure out how to get parents into services, appropriate mental health services, that might actually help families upstream. A second bucket was entry and reunification. And the task force members who participated in that particular bucket was Judge Gore, myself, and Senator Garvin. And the idea here was really around trying to figure out how to engage families better. So you see a lot of things around strategies for early engagement of families, whether you're talking about early in a case right at the time of entry, or you're talking about a reunification, ensuring that as kids are moving home, they have what is needed so that they can stay out of future incidents with child welfare. And so what you see there are some recommendations around just things that like we all should look at and go, well, of course, but it hadn't been done. So making a service plan that's readable, that everybody understands what it means, and that it actually makes sense and it's in English. And I don't mean English the language, I mean readable to all of us and we all understand, or that it's in a language that the person who's trying to carry it out can understand. And making sure that there's clarity even between the court, the family, and the child welfare system, what is intended for this family, and in a sense, what counts. Because I think the system, unfortunately, sometimes the service plans become a little bit of a debate of, well, does this service we have in our community count, or or not, those kinds of things. Establishing a practice model for an approach to intensive reunification. So this came out of a conversation around the idea that we have intensive prevention services, meaning if you're real close to coming into foster care, there is a service that has been built, tested, it absolutely works, has about 80% success at really intensively putting in-home services so that kids don't enter foster care. Why in the world couldn't we do that on the reunification end and potentially shorten your time away from home, but at the time you're going home, build an intensive in-home support model and be able to leverage that for shorter periods of time in out-of-home care. Then developing practices to support biological parents and enhance their understanding. There's a lot about parents not understanding what was happening in court or what their lawyer was supposed to do for them, what the roadmap of their case is, and not really understanding the ramifications of not showing up at something or not participating. And so really, again, clarity around language and understanding, and then establishing a consistent approach to parent, peer, and partner programs. There's been a lot of growth for the last 10 years or so of parent partner programs in various spaces. Drug courts, substance treatment courts would be one space. We have funded some of those positions. They're just in a lot of different places, but there's not, and that's going to be true with high quality legal representation model as well, parent peers. But there needs to probably be some consistency around training and guidance and what those folks are supposed to do, so that regardless of where you encounter a parent peer, that you're sort of getting, in a sense, a universally agreed on standard service, if that makes sense. And that everybody was a fan of seeing it grow as well. It's just they wanted it to grow and be consistent instead of winding up in a spot where you have parent peers in different systems who maybe are in competition with each other in terms of how they're approaching a family. The third was about the actual administrative court process of permanency cases. So this is Judge Allen and Representative Lawson, and they really talked about how to improve the effectiveness of the juvenile court system by enhancing stakeholder engagement. And so some recommendations around the high quality legal representation model, which actually passed during the course of this task force. So the task force definitely wanted to throw its recommendations behind that. That passed with funding to implement in a couple of locations, but not statewide funding. So there's going to be a need for this model to roll out and then continue to roll out and to adjust statewide. So the high quality legal representation program sets some standards and some resources into parent and child quality representation in the court system. And there's some evidence, there's several studies from other states where they have this kind of a model that suggests that it actually shrinks. So when I first heard about this, I was like, that's going to drag the cases out even farther. But there's actually some evidence that actually causes everybody to sort of get dancing together early, and it actually reduces time to permanency by having everyone well represented very early in the case, so that everybody understands what is needed and what's expected. I think it'll be a learning curve, but anyway, the committee was in favor of this. Developing a technology case management solution for court files. So the court is wildly all over the place in terms of common technology. And so this has been a direction that they've sort of talked about, but not really taken a big step in. So I think that was something the committee really felt like the differences from court to court and how documents are handled was a problem. And then providing alternative options for services when necessary services are not available. Families, I love this actually, that we had found a model for the development of an intervention guidance tool. And the idea here is, if I'm in a rural county, I may not have the same service array that a metropolitan county has, for example. How can we give the judges something that says it's okay to substitute this for this, but it's not okay to substitute this for this? So helping the judges understand when it comes to practices, what are more alike and what are more different, so that as they're ordering a family service plan, they can order things that are actually accessible to people within their community, but are achieving the kinds of things that they're wanting to achieve. So I thought this was a really clever way to help judges really feel, I think, confident in the orders that they're giving, but also, like I said, take into account where people live. There are different services depending on where you live. So best practice only works if the service is there. It doesn't do any good if it's not. What else can we do that actually gets the behavioral need met that is needed? Then expanding court liaison positions to better support child welfare staff, foster families, and biological families. There were a lot of conversations around where there are court liaisons, that liaison piece avoids a lot of times loss of information or dropping the ball and different kinds of things. And that was a important role to expand. Stakeholder experience. So this was really more about both folks with lived experience as well as foster parents and other kind of community stakeholders. So Sarah Harrigan and Tavon Lewis were the point folks for this set of recommendations. And really this was also, there was a lot of conversation around how the role of foster parents in helping reduce the time to permanency, how really well-supported foster parents, what I can tell you from our data is this: well-supported foster parents reduce the likelihood of placement disruption. So if kids moving from place to place, and a reduction in placement disruption reduces the time of time in foster care. So even if we just can keep foster homes stable, that actually shrinks the amount of time that kids are in foster care. And then if you can figure out how to equip foster parents to really advocate in the case well, and particularly to support biological families if they're engaging, you start to really pile improvement on improvement in a hurry whenever we have that. So you saw recommendations around how to do things like increase support for foster families, the stipend for support, which really is about like reimbursement for the cost of being a parent, hasn't been adjusted for, I think, about 4 or 5 years. It was adjusted several times throughout the lawsuit, but hasn't been for several years. It is the extra challenge there is foster parent and adoptive parent stipend is tied together. And so there's only around 6,200 kids in foster care right now, but there's 21,000 in foster care. So that number has to be put together when thinking about budget, things like that. It's 27,000 children that are affected by financial support, but there's no question that things cost more today than they did. And so the increased financial support is a stabilizer. Building capacity for childcare to serve kids in foster care. We regularly in the child welfare system, someone will say, I would take that kiddo, but I can't find childcare. And so it is a real problem. So even younger children who tend to be easier to place in foster homes because of the lack of access to childcare. And then even if you have a child in childcare, sometimes the equipping of the child care center to manage kiddos that may have behavioral health needs or trauma needs is not there. And so the kids are sort of not, they're sort of kicked out of childcare, and it really puts foster parents in the lurch. I would say the same thing is true for biological parents. So if we can figure out how to support childcare, it's actually going to solve things across systems. And then providing needed information to foster parents. We will be building, we are in the early process of rebuilding a new child welfare information system. And one of the beauties of the new systems compared to the 30-year-old one we have right now is that there will be layers of access, including the imagination is a layer of access for foster parents, also for biological parents, also for youth. So we can, with technology these days, we can actually build in access for information that you need. That wasn't possible in the old system. So that was kind of highlighted as you build new technology, don't forget about the stakeholders who need to have access, as opposed to always depending on workers or somebody else to provide the information, which is kind of how it is right now, and that's always tricky. Then expanding foster parent mentorship program. So there is a foster parent mentorship program, meaning a foster parent has been doing this for a while, mentoring new foster parents. But the idea here was expanding it. So much like the peer-to-peer with parents or with youth sees success, so does foster parent mentoring in terms of retention of foster parents, and just in terms of foster parents kind of understanding how to navigate a complex system and calming down, like being able to get answers they need quickly so they can kind of actually focus on the case, the child, the family, that kind of stuff, instead of all these million of other things that are sort of distracting. Then administrative DHS, the agency side. So like we talked about the court side, the agency side, Dr. Ferris from OU School of Social Work and Holly Towers were the task force members there. And the goal here was about expanding capacity of the professionals to support families in the child welfare system, and really what is needed for the actual, not just DHS's people, but all the people who professionally serve in this space. And so there was a discussion about enhancing the availability of mental health providers who specialize in working with children and families in the child welfare system, reducing the administrative burden for child welfare specialists, and making sure that we're at a market value for compensation, mitigating the impact of case transfers. Case transfers delay cases significantly. There was a study done in Madison, Wisconsin, some years ago, it's been probably 10 years ago, maybe longer, about looking at cases and saying, okay, if you have a child that enters foster care, what is the odds that in 16 months, which would honestly, for a lot of these cases, be pretty fast. In 16 months, they are either back home or to adoption or to guardianship. Now, what I would say is the cases that reunify go faster when you sort of have to switch gears toward adoption or guardianship. That's what delays us. So we run on average somewhere in the low 20s, maybe 21, 22 months, something like that in general, and 36 months if you go to adoption or guardianship. So that's kind of the range. So when I say 16 months, I'm like, we'd be pretty awesome about that. If you have one caseworker, and you entered care, you had one caseworker throughout the case, the odds that at 16 months you were somewhere permanent, any one of those permanent, was about 75%. If you had 2 caseworkers, it went to 20%. If you had 5 or more caseworkers, it went to 0.01%. That's all, nothing else changing about the situation. And that's because those case transfers often cause resets, or they cause lost information, or the new person has to figure out, there's just time delays. And sometimes there's even direction changes because of caseworker changes. Now, this is a tricky one because the turnover rate in child welfare, and not just turnover, but the opportunity for people to promote or things like that, is always going to exist. We can do things around turnover. You're always going to have some cases where there are changes. So there was also a lot of conversation around how to mitigate it. If you can't completely stop it, how do you mitigate it with things like effective case transfer opportunities? Again, technology. How can technology almost buffer a new child welfare information system, kind of buffer transition so that it's hard for the new person to sort of reset the case because the technology supports it in some ways. And we've seen some things like that in medicine and other fields. And so anyway, those were some of the conversations that came out in these recommendations. And then developing and implementing education programs for professionals working within the child welfare system. And this is more aimed at child welfare, but I would just tell you again, this is broader than that. It's like, how does the court get trained? How do attorneys get trained? How do teachers even understand the system? How do therapists understand it? So I think while the focus was more on child welfare in this recommendation, there was a lot of robust discussion about how you actually broaden that. So that's kind of the set of recommendations. I'll tell you just real quickly, what's kind of next, and then finish up. You can imagine that's a whole lot of recommendations. And I said, those are the only ones that made the muster as far as getting into the report. There were a lot of other things in there that we might be like, we kind of think we want to do that too, but it didn't make the report. We have an innovation services project management team that is going to at least serve as sort of a little bit of a hub for kind of organizing these recommendations and chasing down what's happening with them. Of course, multiple systems will have to engage for them to be successful. They'll have to engage in their own system around improvement. So we might see, like, for example, the JJOAC or the court improvement program take on some elements that are related to courts. We'll see CSAW certainly take on some of the elements, which is a Children's State Advisory Work Group of a lot of different agencies that are child serving. We'll see them take on some elements of some of this prevention and community work. I would expect that that OCCY is engaging, in several different places on this. And so all of that to say, I think we are going to try to provide staff support to almost be the hub, almost put together a project and keep up with. We won't necessarily, the department will not be able to solve all these other systems are going to have to sort of figure out what they're doing in there, but we want to provide lots of staff support, technical support, coordination, and do that actually in conjunction with OCCY. So I actually have probably an ask for you later that I want to talk to you about, and trying to make sure that these recommendations are prioritized and that they begin to be executed. We think it's a roadmap. It doesn't solve all of our, by any means, all of our needs. We certainly have a population of kids entering care who have already had a permanent family, and they're not entering care because of abuse or neglect. They're entering care because they are high needs kids and they don't have access in the system to services. And so parents or adoptive parents are like throwing up their hands. They don't know what to do. This is true nationwide. I was in multiple meetings in the last week with other states. It was the dominant topic, is how to take care of high needs kids and how to not have them unnecessarily come into your child welfare system, or what do you need to morph as a state in terms of systems to meet needs, because what we have right now is inadequate. And so this report at the end of it identifies 3 or 4 things that need further study, and complex kids was one of them. And so I do think we will see, we've actually got some other efforts with some groups that are working on kind of a roadmap for complex kids that we may be able to sort of tag in. There may be other efforts that can almost be this plus the next thing stitched together to really give our state a map for the next 5 or 10 years that we can do ourselves, which is really cool, because the lawsuit is somebody else coming and saying you need to get better. This represents Oklahomans saying here's where we can make improvements, and we're going to lay it out, we're going to commit to it. And so I feel honored to have been a part of it, and also humbled by the engagement of the task force members, as well as the 1,300 plus, however many was, other people who spoke into this, and really, really looking forward to this next season of implementation. So that's the that's the task force. Yep. Questions? I don't know how long I took or how long I was supposed to take, but.
Dr. Deb, great presentation. I'm very impressed by the work of this task force and how quickly the recommendations came to fruition. My question is regarding the coordination of services, no wrong door. I didn't see front porch initiative listed as something to continue. Is that still in effect, or is that, and if it's not?
So I would say ish. It's sort of one of those things that like got a little bitty toehold in a couple of places. Front porch came up, and what the group kind of landed on was, look, we're not sure exactly what the next thing should be, but there should be some organization around taking things like front porch, things like Be a Neighbor, things like there's these other platforms, Unite Us and Chess and all these other things that are out there, and sort of figuring out how to solve for that. So they did mention it. It is not something that it's actually shrunk since it started, and it wasn't very big to begin with. And I think probably the heavier recommendation was around school-based social services. And then there was some chatter about family resource centers too, which in a sense provides something kind of like Front Porch was doing. And there's been a lot of growth around family resource centers. It didn't make it into here. There definitely was some talk about, and with health department and things about family resource centers. So I think it's one of those buckets where it's like, we need this, but nobody had a solution of like, do this thing and you'll get there. It was kind of, it felt a little bit vague.
We tried this, and so
Yeah, it felt a little vague. So yeah, that's what it is. Yeah. Any other questions? Okay, thanks, you guys. Yeah,
A
John.
couple comments to make real quick. One, I can't tell you how excited I am about this, because as you go down through all of these things, these are the things that I hear at my office, my foster care workers, my shelter workers, these are the things they're talking about.
So it fits. with what
Literally
you're
every
experiencing.
problem you've identified and potential solutions, it's the stuff I hear from the workers' boots on the ground. So that's extremely exciting to me. Two, I noticed you mentioned prevention, very heavy on the front. As you guys know, I'm here representing the Youth Services Association. And if there's anything that we can do to be a part of that conversation, we want to help. We're very excited about prevention, and we would love to be a part of moving that needle forward as that conversation
Yeah, that's
develops.
actually a really great point about the resources we already have. And I think especially in that first recommendation, part of what there was a recommendation, what there was a realization of is we have lots of stuff. Is it put together and coordinated in a way that actually gets families down the road? And I think you're exactly right. We've got an asset in youth services agencies that are already serving communities, but if we organized in a way that, works for where everybody knows who to send toward a youth service agency or what they're going to get, those kinds of things. So, yeah, good point.
From what I understand, Dr. Deb just flew in yesterday from another engagement, and I don't know a lot of people who can come in and give a presentation like that with very little sleep and after travel. And just thank you so much. And it's your heart and your passion is well evident in the work you do. So thank you.
Well, I'm excited about this. I think there's 5 years of work in here, and if we get that 5 years done, I'm like, what can happen next? I will give you a little sneak peek too. Not that sneak, I guess. This is a good news, bad news. So one of the metrics we track for permanency timeliness is time to permanency in the first 12 months. So we track 0 to 12 months, 12 to 24 months, et cetera. We've actually improved pretty significantly over the last 2 or 3 years around that 0 to 12 months period. Now, here's the downside. We've improved ourselves. We've also improved against the national average. That's because the national average dropped by 5%. So we've improved, which is good. But the national average dropped by 5% due to COVID, I think almost entirely due to COVID. And so you saw that number go from about 40% was the national kind of average, median or average, I don't know which one, but the one we sort of look at, say this is the bar. And it dropped to a little over 35% just through the COVID years. And I think court delays, but also service delays, lack of services, all the different challenges that people are facing have really dropped that. It makes me very sad because that's a national metric. That's a lot of kids and families, kids that are sort of stuck in foster care longer in just a very short amount of time. So I'm glad that we are seeing improvement. I'm really sad that the national metric kind of went down. It's something for us to keep an eye on. But anyway, I think we have good traction. So pretty excited about this next few years and what we can do. I will also say though, I say for 35% is the national metric, even if you use it 40%, you would not go to a hospital or a doctor's office and them say, you got a 40% chance of making it out of here. You'd go to a different one. Like if you walked in the door and they're like, here's your odds. You'd be like, can I get a second opinion? We should not settle for the idea. That's not even just about kids going home in the first 12 months. Some families take longer, they need more. The truth of the matter is only about 40% of kids ever go home. We should not settle for that. And so I'm really pleased that this task force focused a lot of its energy on families upstream and also families after they reunify, because I'm not happy with the reunification percentage. As a physician who I just think you would never pay for anything else. You would pay your car mechanic for a 40% chance your car is going to get fixed. We should be really, really trying to figure out how we strengthen families and avoid the child welfare system and then make it as robust as possible with the highest likelihood of kids being with their families. So anyway, a little food for thought. Thank you.
Thank you so much. All right, thank you for your presentation. Okay, we're moving on to agenda item number 8, presentation on the State Post Adjudication Review Advisory Board's request for a formal attorney general opinion on the question of whether the Oklahoma Constitution guarantees the right of a jury trial in a termination of parental rights proceeding. So with this, I will turn it over to Keith Kirtle.
Well, you basically did it. That's what we're going to propose. But to give you a little more background and to tag on to the Post Adjudication Review Board community is also excited about the governor's task force. Our members participated in the survey. And like you said, you know, if you help create something, you have a lot of buy-in. Plus 2 of the members are our state park members, Sarah Harry and Judge Allen are both also on our state park. So we're excited, and we've already kind of started looking at and figuring out places where we can partner. So really looking forward to that. So please keep that in mind as well. So before you today, which should be an interesting topic of conversation, just to remind you, the State Post Adjudication Review Board really is tasked with 2 different things. One is overseeing the Post Adjudication Review Board program with its 300 volunteers and 42 boards. And the other is to identify and address systemic issues related to the juvenile court. And so in June, I presented before you guys 6 recommendations that we came up with after looking, you know, for the year. And one was to eliminate the right to request a jury trial in term for parents to request a jury trial in the termination of parental rights cases. Then, of course, I think most of you know Senate Bill 706 was passed, and which kind of gave a timeline to that. At our last meeting in August 30th, the board looked at that and thought, well, what else can we do to try to move this ball forward? We really would like to do more. And I've got pages you could look at that I could send you to the Judicial Advisory Committee's report from 2021 to look at the arguments for the elimination of the jury trial. For one, Oklahoma is one of only 4 states that still has that. But basically, the board voted to request an attorney general's opinion with the question of, does the Oklahoma Constitution guarantee the right to a jury trial and a termination of parental rights proceedings? So that's the board agreed to do that. We're getting ready to submit it, and I guess procedurally kind of figured out after the fact that we needed to come before you. And actually, it needs to be yours to move forward. That's where we are. I hand it over to you for your consideration as a kind of a formal request from the State Post Adjudication Review Board to submit this kind of on our behalf to the Attorney General for an opinion.
I would like to clarify some of your points, not necessarily substantively, but about the opinion process. Since OCCY has such a large legislative oversight breadth, it was recommended from the higher powers that be at the AG's office that you guys submit this formal opinion on the post-adjudicatory review board's behalf. And so if you turn to page 121, you can look at the letter that Mr. Pirtle and the review board have drafted up. It would essentially, it would be my recommendation and Sandra's as well to keep it the same. It would just be from Mr. Schneider or Ms. Jacoby, and, you know, making it from OCCY and the Oklahoma Attorney General opinions do have the force of law on agencies, but they would just, at their persuasive authority on everyone else. So keep that in mind as you go into your considerations of the question. So, thank you.
Thank you. Questions or comments do we have?
So we are not issuing an opinion on whether or not to have a jury trial. It's just that we are voting to seek a legal opinion on the question before us.
You will be, there would be a motion to approve the request for an official Attorney General opinion on the PAR Board's request on behalf with the modification, with the necessary modifications to be from OCCY. If that makes sense, I could make it a little more clear.
So I understand you're saying it's the preference of the AG's office that it come from OCCY, not the board. But statutorily, the board does have the authority to ask for it, correct? I mean, because any board, commission, or department can request one.
Since OCCY has such a large scope of legislative authority that they oversee the workings of the PAR boards, it is the Attorney General's preference that it be from OCCY, and that would be why Mr. Portal's before you today asking for it to be from you guys. But you could keep the same language. It would just be from your chairperson or executive director.
And it's my understanding that there's a 1987 opinion from Justice Cogger, basically recognizing a constitutional right to a jury trial in these cases. And so I guess my next question would be, since there is already a Supreme Court decision saying that there is one, what weight would the AG's opinion have on changing anything? Or would it merely just be an opportunity for the office to say, hey, we think the court got it right, or we think the court got it wrong?
Well, I would also say since 1987, the scope of the law has changed entirely as well. You know, equal protections has been expanded entirely, not just nationally, but also in the state of Oklahoma. So I can't speak to whoever will be writing the opinion and the Attorney General himself as to what their findings would be, but I can't necessarily say that the outcome could be the same, but if there's nothing, it wouldn't hurt to try, so to speak. Especially since this has been a reoccurring request and issue before the board. Or before the commission, rather.
Are there any other questions, any other comments? Any motions to be made coming out of this agenda item? Okay.
I'll move to approve the request for a formal Attorney General.
I'll second.
Yeah, we have a first and a second. Any further discussion? Hearing none, please call vote.
Commissioner Aaron,
Yes.
Director Cartmill,
No.
Director Front,
Yes.
Commissioner Hall,
Yes.
Commissioner Kurth,
Yes.
Commissioner Laird,
Yes.
Commissioner Schneider,
Yes.
Secretary Shropshire,
I'm gonna abstain.
Commissioner Slayton Hodges. I'm sorry. Commissioner Wilson,
Yes.
and the motion is passed.
Thank you. Agenda item number 9, presentation on the Handle with Care overview and fiscal year 2024 priorities. I will turn it over to Adrienne Elder.
Thank you. I have some quick slides to share as that's being pulled up. Just want to, I appreciate the following the Child Welfare Task Force report. Something that Handle of Care Oklahoma is a collaborative on breaking silos and creating connections. Handle of Care started actually in West Virginia in 2013, and now it has collaboratives across the country. And I'm happy that Oklahoma has a collaborative that involves interagency collaboration since 2018. And OCCY has been instrumental bringing Andrea Dar, who's a co-founder in 2019 to Oklahoma. And that was another way of kind of increasing awareness of how important it is to connect these kids with supports, especially after a traumatic event. So we had a planning grant from the State Department of Health, and then we have been working closely with Oklahoma Department of Public Safety as law enforcement are kind of the beginning of. So we can just advance maybe the next slide. I can share this one. Did I just click it? No? If you don't mind just advancing for me, that'd be great. But the next slide is basically just a very, very simple version of what Handle of Care is, if you're not familiar. So just a quick review. If kids or teens are present at a 911 scene, the first responders notify the school. Obviously, no details are given, just, hey, heads up, handle this kid with care. The teachers get a heads up so they don't, if a child is falling asleep or acting out, it's not because they are trying to be disrupting. It is actually because they are in that fight, flight, or freeze mode, and that they actually need some extra supports for that day. And so it really does speak to kind of a multidisciplinary team approach at the school level to provide those supports to kids. And it can be from a classroom intervention level to an individual intervention level. And so it's really just making sure those children feel safe in order to learn. Next slide. I think just, we have been working with multiple counties across the state. Last count was like 35 counties. I think there's over 260 schools that have been at some level of interest to implementation of Handle of Care. We have some great videos that can be shared later. Next slide. So one of the things that I am super honored to share is how Handle of Care is just one piece to the bigger puzzle. And we are talking about, like, what does this look like from an interagency perspective to increase collaboration? And we've been working with some members of the Parent Partnership Board over the years to, like, can you put it in one visual? Like, how does this all work together? And so there are these great conversations about, well, there's these puzzle pieces, but it's like, when the rain and, for all the adversities from the individual family and then community and structural adversities come down, how can communities and families decide to open and close that umbrella when needed? And so this is the visual that was created. And I think it's beautiful and love all the colors. But really, I think just the main takeaway is that building that foundation of hope and trauma awareness, and then Handle of Care has been a great first step for a lot of communities. Like, okay, great, now we know about the impact of trauma, but what can we do? And so a lot of that coordination. It doesn't have to be called Handle of Care, just whatever you want to call it at the local level to increase coordination. How do you really look at those multi-tiered systems of support, whether that's with schools, with family resource centers, and then some of the shared measurements. I know Oklahoma Healthcare Authority has been a big advocate for some shared measurements around social drivers of health, and that those can be baseline and 2 or 3 months to then show progress. And then with a participant waiver, there could be an election for families to share their health outcome data so that that aggregate data can be shared, 2 years or 4 years to show health outcome improvement. And then you have the parent and youth advisory committees at community family resource centers. And with all those things in place, it shows how movement can change. So next slide. Of course, handle of care, or you can put just interagency collaboration. How does that benefit each community? They're taking initiative, really, they're taking ownership of how they can increase that communication and coordination to connect children and families to supports. It builds that trust. It promotes problem solving at the local level, and really increases that family stability. And it's low cost because it advances current partnerships, what is already existing at the local community. So next slide. This is just a quick reference of some of the staff that are already within some of your agencies that are doing some amazing work with the initiatives that you've already approved. And they are just using Handle of Care as a way to advance that communication. So we're really happy to see that cross-sector collaboration and ways we can move that forward. Next slide. We've been continuing to provide some information on Handle of Care, on how they can advance in their community, some foundational training. Neuroscience has been a wonderful trauma training that has kind of spread statewide. I know the Potts Family Foundation has been working closely with the OCCY Center for Family Resilience. I think there's over 120 trainers. I don't know if anyone has the numbers on that, but it has been a great resource, and we've been in discussions with AJ Griffin on what does that look like to enhance those collaborations. But that has really created a good foundational layer. And next slide. Oklahoma is used to being at the bottom 10. It's nice that Oklahoma is actually being recognized as a top 5 state for implementation. We would love to see that continue. We did some legislation last year to try to make it official, being a statewide initiative. It passed the House unanimously. It passed the Senate unanimously. It got to the governor's desk, and it was pocket vetoed. So we encourage each of you, as you have connections with the governor's cabinet, to see what those issues are. We've tried to reach out for feedback, and we're still trying to get that information so that we can move it forward. I think there was an Office of Homeland Security wording, and now it's changed to Department of Public Safety. So we did make that adjustment. But we will be working that in December, and of course, we would love to be included on the legislative priority in January. So I'll work with Marcia and Annette on that. Next slide. I think one of the things that we're having trouble with, and I'm getting over allergies, so I apologize, I'm coughing, is we are trying to develop a state map and to see kind of the implementation phase. But we're having trouble with who should be the contact in each community, in each county. Next slide. We're getting you some moderator.
Yes.
I know, I have some right here. Thank you so much. So I think the main thing is, again, there's no action today, but just for discussion, and I'll try to throw it back to you because I can't talk anymore. But just continuing the endorsement, we appreciate your support, adding it to legislative priority. And I think the commissioners just continuing to share, asking staff to continue to advance it within your current initiatives. And I think as we try to advance efforts between law enforcement, schools, behavioral social health providers, if OCCY wants to be considered to be as a coordinating state agency, and then what does that look like to enhance public-private partnerships with community-based organizations? So I'll stop for questions.
Thank you.
I just have
have a quick comment. We've talked about this in our multidisciplinary team, of having a training come out for this, but maybe that's somewhere that it could land with our PARB and multidisciplinary teams. That could be a contact within communities across the state, because those multidisciplinary teams have all of those services already sitting there, your law enforcement, your school-based. I just thought of that, like that would be a great landing place and consistent across the state to have that be a place of contact at least, and then we could host trainings. I know for us specifically, we were wanting to invite a Handle with Care to come out and train ours this next spring, so.
I think that'd be lovely. Because again, we want to use existing infrastructure. We don't want to start anything new. And I think between that and the systems of care coalitions, you know, how there could be, because I think the systems of care coalitions may not have the the capacity to facilitate some of the conversations and the partnership agreements. So I think that's one of the things that we see as a community barrier and feedback that we get all the time. So we'd love to explore that with you.
Any other questions? All right, thank you so much for your presentation.
Thank you.
Okay, next we will move on to agenda item number 10, presentation from ODOT Mobility Management Programs. I will turn the floor over to Olivia Cook. I'm sorry.
That's all right.
I misread that, I'm sorry.
No worries.
If you don't mind, I'll let you proceed the slides. Kind of learned. Okay, all right, this is my little timer. I have a lot of ADHD. I love my program. I love to talk and I won't stop. So I wanted to have that here. All right, I want to thank you so much for having me today. I actually recognize a lot of you off this board, and I'm really, really happy to see a lot of friendly faces. And also thank you for inviting me, Danielle and James. I've been working with them for a couple of years now on a program that ODOT has been launching for a couple of years now. It's called Mobility Management. So I'm going to talk to you guys a little bit about that today, but after hearing some of the presentations before me, talking about siloed state agencies, I am so glad to be here. I don't want to be siloed anymore. I know we have roads and bridges, but I work on moving people. So that's something I'm really excited to talk to you guys about today. All right, so next slide, please. I want to just talk a little bit about community mobility. It's not an easy thing to explain. So if you're an individual, maybe even an individual with a family, and you're looking at transportation, even in Oklahoma, we have a lot of options. We have specialized transportation for seniors and individuals with disabilities. We have airplanes. We have a commuter train that goes down to Fort Worth. We have cars. We have carpools, van pools, all of these different modes of transportation. And then you throw it to the next circle. You have your own situation, whether you're in a wheelchair, or maybe you have a service animal and you're not even sure if that's going to accept your service animal on that transportation system. Or maybe you have some mobility tools that you're going to need, or you have a family with your stroller. So that, and on top of that, we'll go to the next circle, which is you have time, you're on a schedule, you're limited on funds that you have, and geographically, is this transportation going to get me to where I need to go? It is not an easy thing to process, especially when you're a family that is already at a vulnerable situation. And ODOT recognizes that. So let's go to the next slide. And I just want to talk about, because we have programs out there, there's eligibility, reduced fare, things like that, but it isn't enough. You have a family of 4 that is getting the reduced fare per person, that's $6 one way. So if someone needs to go get groceries, that's $12 out of their budget that was going to go for the groceries. So for me, that's my challenge. I wanted to eliminate that burden that is on families. So there's always a challenge when it comes to transportation. Next slide, please. Mobility management. This mobility management program identifies gaps in service that these maps don't show. At the State Department, this is actually a layering of 3 different maps. I've got my urban systems, I have my rural systems, and I also have tribal transit. And I layered all 3 of those maps, and I'm like, wow, we have a lot of things moving in Oklahoma, but I can tell you right now, I have all these people that have even contacted me this week, and I cannot get them to where they need to go with my existing services. So I have a lot of work to do because it's not just the services and as they are, and I'm trying to connect people. I'm actually working with the services to improve what they're doing. This mobility program is setting goals and strategies and doing surveys and actually assessing where are our needs at and what are you doing? And it's not just falling on one transit system, it's all of them together. I'm looking at Southwest region saying, okay, Southwest, we have all these problems. What are you doing about it? What are we all doing together? So I'm actually trying to eliminate our own silos within our own industry. Next slide, please. So there's those maps I was telling you about where I layered them. It looks really neat to kind of get that bird's eye perspective of where are they serving? How are we moving people? And where are the areas that, you know, they're focused too small, like maybe up in that panhandle where you see the little red dot. That's a very small service area. When you're an individual who needs to go to Oklahoma City for a medical trip, you're not going to get out of that city limit. So it just really gives you a perspective on where things are. And maybe even with a fresh perspective looking at it, you might go, okay, I could kind of see where that problem looks, you know? So this is really just kind of helps us get that perspective and just show you guys how complicated transit can be. Next slide, please. And I want to throw in another little provider into the mix because we federally fund our public transit systems, both rural and urban, but we also we fund specialized transportation. And there's a bunch of these little providers all out throughout the state. They're supposed to be providing the services for populations, but they're also supposed to be connecting between public transit and other areas. So going in between, filling in the gaps and things, and that's not necessarily working out so well. So that's where I definitely need to be focusing on, but also having boots on the ground with this mobility program. Next slide, please. There are so many factors when it comes to what public transit can and cannot do. And that's one thing that my program does, and even myself, is I work with transits, and when they say they can't do a urban to rural connector, I'm asking why not? Why not? Sometimes it has to do with, usually it goes down to money and regulations. And I always know where the loopholes are with regulations, and I love flexing that because we need to make sure that our systems actually fit the neighborhoods that they're serving. And a lot of times they want to just shove that wrong side peg into the circle hole, and they're saying, yeah, this system, it's there, you guys just figure it out. No, it's not working. We've got to drill down and understand exactly, is it the funding? We need to fix that. We need to get our systems communicating. We need to get them working together. We need to keep from restricting people from traveling to where they need to go. So that's the problem I'm trying to solve, is making sure that whenever there is a funding dictating where our transportation services are, I need to flex that to make sure that they're serving the communities based on what the community needs. Next slide. Now, all of that being said, you guys got the Cliff Notes version of transit in Oklahoma. You got to know what's operating, what the, where our gaps are, what our challenges. And when you're a family that is wanting transportation just so you can go and get your groceries, so you can go to the park or go to trunk or treat for Halloween, it's complicated. Can I even use it? It doesn't go after hours. It isn't going to go to where I need to go. Is it even going to be there to pick me up when I schedule it, or is it going to cancel on me last minute? It's so complicated. And for me, as a state person, I have transit systems, but I don't have anyone throughout the state helping people when it comes to challenging transportation, helping them solve that problem. Me putting out a brochure is not the answer. So the next slide, please. I wanted to go into what mobility management is. I'm starting this program, and I actually have a few programs active, and I can't wait to tell you about them. But mobility management is a program that I'm placing throughout Oklahoma. I'm going to have eventually 25 mobility managers locally placed strategically throughout the state. And they're helping individuals find transportation, solve that problem, but also taking that problem back to the planning side of transportation so that we can start planning efficiently and proactively and start to put together projects, teaming up with other non-transportation state agencies so that we could build in a transportation solution, because everybody's program needs transportation for the people that they serve. So with me failing, it means all of you guys are going to be struggling even more with what I'm not able to support for you guys. So mobility management is essentially a social worker for the transportation industry. It goes in so deep because we actually are looking into not only helping out socially, but they're working as a systems level, working with the transit systems, advising, holding their feet to the fire, saying, hey, you've got to step it up. We cannot do the old traditional way of things anymore. Next slide, please. I will go into the technical definition. So Federal Transit Law 5302 explains mobility management is a capital project of short-range management projects, and it's for coordinating services between public transit and other service providers. So that's the primary goal, is they're working in between, getting these transportation systems to really talk to each other. Some of them don't even like each other. Some of them are, having turf wars. You're coming over here, move my people. Well, at the end of the day, you guys cannot possibly have the capacity to move everyone who needs you. So don't be, bickering over the last little person that was on the county line. It's everyone working together. And it actually excludes operating public transit services. So one thing I did when I first started placing this program is I didn't look at transportation agencies to place the program, because I have a background where I worked at a different state agency and I had this program, and that's how I got here. And I had transit-based mobility management programs, and that became a problem because those transportation agencies would teach and treat that mobility program as a universal person. They would fill in and hire dispatchers. They would train drivers. They would be even out driving vehicles, and essentially they would be applying for transit grants. And that was not what the mobility program was there for. It was there for moving the people. The mobility manager doesn't answer to transit. They answer to the person in the community. They are not there for the best interest of making sure ridership's up. It's there making sure that the community results we hear from everyone in the in the community is saying, yes, that meets my needs. I need something else now. Keep working on that. So that's the difference between mobility management. Next slide, please. All right, so I have a lot of needs I'm working on, and I actually got another order of needs that came out of the recent plan that I did this year. So this is from a couple of years ago, and all of these issues and needs hold true today. And I had that conversation with public transit when I first came here 3 years ago, and they said, well, we're working on all of this. We don't need mobility management. We just need mobility managers in our agency so that we can have an improved system and we'll have this extra person. And I'm like, no, 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 no. All of these issues would change if you had a mobility program across the state, because they would be working on this as well as you, going in between, making sure that every transit system is actually doing those things. So that is on our agenda. That is everything I want to work on. Better information for family services, connectivity between the agencies. Next slide. Now, I wanted to talk a little bit about this because I talk about transportation as a whole because it's on everybody's, a struggle, whether you're a senior, individual with disability, or a family, or maybe you're a youth that's just coming out of high school and looking for a job, and maybe getting a car is not your first priority like it was 20 years ago. So making sure that our services are going to be there for our aging population, and in addition to that, our younger youth. So a few things I heard recently, and actually came from James, he shared, these are some of the things that we're hearing from families right now, is resources are extremely difficult and even more difficult to find transportation to access those few services that are available. And this is in rural areas. Now, coordinating times to catch the bus can be overwhelming, especially if you're a family that's in survival mode, you're panicked, you have no resources, and you have no hope. Also, many youths cannot afford to pay for transportation, making it hard for them to go out and find a job or even keep a job. So these are just some things that now that I know about that becomes my problem now. I want to work on those things, and that becomes the program's agenda as well. Next slide, please. There's a strategic approach to this program. There's a lot of things that they're doing, and it just goes layer after layer. They're doing mobility projects, talking to communities, building outreach, attending community events. They're talking to partners. They're developing all of these different, MOUs and agreements and new stakeholders in the transportation conversation. So they're doing all of those things, and that's identifying those goals to identify those unmet needs and close those gaps through those partnerships. But another thing is they're connecting individuals with the transportation options that meet their needs. They're also building that awareness to all individuals to let them know, hey, there is transportation assistance by me. I will help you, figure it out. Maybe it's not there on that website saying that they're going to get you to your job every day if you have a conversation so I could work out those nuances, but I can do that. So just contact me. We'll help. We'll talk through that. So it's definitely a deeper dive than just, oh, hey, there's some information. No, it's very much a social worker when it comes to that side. Next slide. The big thing with helping people access transportation is a thing called travel training. There's actually a certification program that I have the mobility management programs go through, and it's for Easter Seals Project Action. And it helps these mobility programs understand, you know, how to explain transportation to the general public and help that person. So that person's going to be able to understand how to read the transportation schedules. Have you guys ever read those? Those are so confusing. I know I work at DOT and I have a hard time with it. Locating the bus and train stops, how to flag down things, you know, the bus, how to obtain your transit passes, how to find help for that transit pass, because you may not meet the eligibility requirements on the website, but maybe when you talk to my program, they're going to find donors that can afford to support your transportation need. We're finding those unique solutions for those individuals slipping through the cracks. So it's actually going through all of those things so that individual's not going to have just a few little tidbits. They're going to be so fully trained to understand, here's what you can do, plan A, plan B, or call me and I'll help you out. So it's just not, you know, you're just not on your own. Good luck. Have a nice day anymore. Next slide. There are a few initiatives happening with Oklahoma Transit, and the mobility program also brings that to light as far as building that into the communities, building awareness. And this is one of the major initiatives that has happened in the last 2 years. Oklahoma has a Rolling Oklahoma Classroom. This has gotten national recognition. And the Rolling Oklahoma Classroom was a project that was funded out of, I believe it was the FTA funds, the Federal Transit Administration funds. And it was a bus that was designed to enhance awareness around public transit, but also the human trafficking. We have found out that basically public transit is the #1 mode of transportation for individuals that are being trafficked. And we pulled together public transit directors, and the one in Tulsa was very upset to find that his bus stop was a hotspot for and nabbing children. So we've teamed up together to build awareness not only to our transportation providers across the state, but also to communities. So we've actually had this bus set up around community like festivals and things like that. It went to Enid. A lot of individuals get on the bus and learn about options, but they also learn about how transit is watching for these things to stop that. And then they're also hearing about these stories from children and that were trafficked. There's artwork that you can see on the picture on one of this, and that's actual Oklahoma rescued, you know, victims of human trafficking. So it's a very touching thing, and that bus will come to your location for free. But the mobility program is actually working hard to bring that into the communities even more and not leaving it to just the transit systems to schedule that. Another thing, go to the next slide, please. Another project that we are working on is we're partnering up with the Climb Ride program. Some of you guys might be familiar. I know Deb's like nodding her head. I love the Climb Ride program. It's basically a foster system program that builds transportation solutions into that family planning. This is 100% replicable with other human service programs. So if we work together and sat down and you tell me what you guys are doing with your program and I ask about what can transportation do, maybe I can get the families that you're reuniting and they have to be out in the community now. How can I make sure that they're supported as well? Maybe it's a bus pass for a month or a year. I can get them something like that. We can get a system set up to support their travel needs as they're trying to recover in the community with what you guys are doing. So this is absolutely replicable. And one other thing is this is a program that's in Oklahoma City. There are a lot of conversations about expanding this statewide, and the holdup is me. I need mobility managers across the state. I'm working on getting this program so that we can, you know, maximize on it. But that's the holdup too, is that we're trying to get these mobility programs started so that we can expand that out. We're also working to team up with other community supports, but that's just the major thing is that to work together with transportation systems, it takes a lot and you have to be able to read the lingo. So, but that's one other thing there is that the Climb Ride program is fantastic. I want to build this out to reunite families, especially in rural areas, and see how that works. Next slide, please. Now, I just want to go into what we currently have happening here. And these are, this is actually a handout that is in the packet that went out yesterday. But this is the current mobility management programs I have right now in Oklahoma. They all started this year, and there's been a lot of training, a lot of learning, a lot of finding a lot of the skeletons in the closet too, you know, where transit systems like, oh, I didn't know I wasn't supposed to go here. Or sometimes it's those specialized providers that we didn't realize they were not using their vehicles all of the times that they were supposed to or sharing those vehicles. So we've been learning a lot, but there is a lot of Oklahoma that still needs to be served. Can you go to the next slide? So this is where I want to go into the funding this program, because I have 4 programs essentially, but I need about 21 more. Now, ODOT has funding, but we are limited, basically, because I have about $600,000 and then my money's gone. And we're actually drawing down unspent transit dollars for the last 3 years. So I get to spend all of that out. But after that, I only get so much of the piece of the pie when it comes to all of the other transit systems. And I do understand that, because when I get a mobility program, that's a vehicle that they can't award to a transit agency. So that's moving less people, but I need that person to move people. So how do we divide those dollars up? Another thing is, like just the local match, because even if I do have the funds, I need local match for every locality. And that's about $20,000 a year per mobility manager, and I need to add 21 more. So the reason I'm bringing that up is because I want us to eliminate those silos when it comes to finding funding for these programs as well, especially when a program such as this could absolutely just change the face of transportation. And honestly, we'll be one of the top 10 states if you go and look at that nationally if we do this. Next slide, please. So there's one thing I want to talk about is the Coordinated Council for Access and Mobility. That is a council that comes out of the Federal Transit Administration. They actually identify, so my mobility management program comes out of a circular that is out of the 53 programs. So the 53 programs can actually match federal program dollars per federal per federal. Usually you can't match federal dollars with federal. Here you can with 53 programs. So that's where I was going to mention is that all of our programs in any state agency, there's a CCAM table. It identifies what programs in every state agency will fund mobility management. It also identifies where we can fund fares together. So maybe we want to talk a little bit more about, hey, what about, let's set up a program out of all of our programs to pay for fares for families that were reunited in their, like where we were talking, like I just mentioned, let's get them a ticket for a year, but that would have to probably come out of something like this. So we could definitely have a lot of conversations, not only about funding the program, but also projects. So like I was saying, that replicable human service projects working together, we could find funding for anything. So the sky's the limit. So that's where I wanted to just go to is that I am always going to be thinking of how do I serve families when it comes to enhancing mobility. But I want to go to the next level and talk to you guys and see what we could do about mobility projects that move the people that you need to move. Next slide, please. Engaging with this program on a local level. So I wanted to just kind of ask you guys for a few things. Invite that when you have a mobility manager in the area, or if the areas that you have programs, when I have a mobility manager, introduce them to your localities. Let them know there's going to be transportation committees, coalitions, conversations. You could join the table and talk about transportation in your region to the people who are moving people, and you can hear about what they're doing. So I want you to just invite them to your agency, but also join their activities. Go to the Rock Bus when they have that in your community. Get on the bus, talk to them about transportation, bring, other community members. So I just want you to definitely engage with those programs, build awareness around it, and then also share the program. Individuals are going to need to know that they can call someone when transportation cancels on them last minute. So I definitely want you guys to just be aware that this program is going to be out there regardless of what we all are able to partner on. I'm always going to keep you guys informed on this program as things roll out. But this is definitely a way I want us to definitely continue to, work together as we connect Oklahoma. Next slide, please. Now, here are my current mobility management programs. You got me. We also have Chandler. She's in the Enid area. There's Christy. She's down in the Southwest Burns Flat area. Clem is in Tulsa Transit. And then we also have Todd. He's down in the Durant area. So I have currently 4 mobility programs, and I have 3 in the wings right now that are going to be starting January 1st. So, and that next area is Lawton. And I want to say Lawton, Oklahoma City, and then also the Muskogee area. All right, so that was the last thing I have to share with you. So before I leave though, the commission, I do want to ask you for one, support. I'm going to be pursuing this program and expanding this aggressively. I'm going to be applying for discretionary grants, everything. So the one thing I want to ask for you guys is, first of all, to, be partners with me. If I ask you for a letter of support, I would love to get a letter of support. And I am so blessed in anything you have supported me in the past with. But I'm going to be building this program out, and I just hope that I can lean on you guys for support in that. Number two, I just hope to be able to work with your programs to identify through the CCAM funding if there are any opportunities for us to, braid our funds, whether it's for a project to help, reunite families with transportation, or it maybe it's to get this program launched in areas that you have a higher need for. Also, the second thing is whenever there is a survey, complaint, data, anything that you guys hear that relates to transportation, include me in the conversation. Send it to me. I want to hear those complaints because I want to work on those too. So anytime you guys are facing that, I don't want you on your own on that. I want to show up and be there to help out with transportation so that you can't say, oh, sorry, well, hopefully they'll figure it out. No, I want to come to the table. And then last thing is build awareness around the program. Thank you so much. That's all I have.
I would just like to mention Olivia Melinda Front, Department of Rehab Services, not inside the little Zoom box, but it is an awesome program. It's been well needed, and we've partnered on some reports and letters of support. And we're excited about the future of how it's going to impact individuals with disabilities across the state. So
thank you.
Yeah.
Yes, absolutely. I'm very, she's one of my best partners. There are some exciting things. I'll keep you guys in the loop. Thank you.
Thank you, Olivia.
For that.
We saw in the Climb Ride program, the pilot or the what we did in Oklahoma County, which was only where it was available, but a significant bump in reunification rates with having transportation. And now we're expanding it, and we're also actually working on an expansion with the TANF population, because TANF's population, it's hard to get those work efforts if you don't have transportation. So, yeah, and it's, it's that 27/4 world that we live in. I mean, 24 hours, 7 days a week. People are working at all hours. The system is an 8 to 5. Consistently late, you just can't live a life like that. And when we're promoting work for individuals with disabilities or all the other programs that we all work on, transportation is always the #1 issue in the state of Oklahoma. And I'm so excited that Secretary Gatz actually started this process. He meant it, and he's the first person I've seen take it so seriously, and I appreciate his efforts. And, he talked to me straight away about impact of individuals with disabilities. And of course, we have older individuals who are blind that still want to go to work, and, just the whole process of that's what community is about. So, yeah, this is huge for Oklahoma. Olivia, you got a lot of work to do.
I know, it's scary.
Yeah, it is.
But that's what I came here for.
That's
I am
right.
so excited. Thank you.
All right, any other comments or questions? Well, thank you so much for your presentation and for sharing with us. Appreciate it. Okay, next on the agenda is agenda item number 11, Executive Director's Report, and I will turn it over to Annette.
I provided a written report, and I'm happy to answer any questions if you have any concerns or any thoughts about what I submitted. In addition, I just want to bring to your attention, the Cross Systems Coordinator position is vacant. So we'll be hiring someone for that position. So if you know of anybody good that you think would be a good fit, please send them our way. We'll be moving on that real quickly. And then lastly, not in the report, I know there was a lot of excitement about the folks that came for our retreat from the Montana Institute. I've reached out to the state agency heads because I can put them on an email and there aren't enough of them to make quorums. So I'm not getting in trouble, but also because they may have, I think they may have an interest in at least thinking about coordinated contract, because what we don't want is like 10 different individual contracts, because that is exactly what we said we didn't want to do at the retreat. So we're going to think about maybe how to rally around, and then we'll get everyone's input on what it is we'd like to do with them. So I wasn't trying to leave anybody out, but I just didn't know if I'm thinking they might have funds, some discretionary funds or something to add to that pot, or some restrictions like we all do in state agencies on how to contract or if it has to go out to bid and all those kinds of good things. So that's why I put them in the loop first, but we'll continue to talk about that in the future, not trying to leave anyone out. And with that, I'll just be happy to answer any questions.
Any questions for Director Jacoby?
Okay, thank you.
Thank you. Okay, any agenda item number 11, any announcements from the commissioners?
I have a quick one. They finally have the press release out, so I can officially say, SWOSU is launching the Work Ready program, so we got the contract. I was one of the principal investigators on that, but anyways, we've already hired our director, our manager, so that program will train, have trainings for workforce, but transportation, that huge piece of all of the things that we've already had several community coalitions. SWOSU is really, really excited.
That's great.
So we're able, all of those employees of Work Ready are actually SWOSU employees. So that was pretty big. So I'm excited to be a part of that. We're the first one over in Western Oklahoma. Woodward will launch with us and then they'll have another round of funding too. So.
That's awesome. Any other announcements? Okay, agenda item number 13, chairperson comments. I just wanted to briefly say thank you to Director Jacoby. This takes a lot of work to put all this together and coordinate, all these presentations. So thank you for your work each month to do that. And thank you all for being a part of this discussion. We can't have a good meeting without your thoughts and considerations and time that it takes to do this. So special thanks to our presenters. Everyone did such a fantastic job and I appreciate the time it takes to prepare for that. So with that, I will move on to adjournment and call us adjourned at 11:31.